Hi, good afternoon everyone. My name is Adrina and I'm a community pharmacist working at Watson's. Welcome to the Watson's Facebook Live segment on Ask Our Pharmacist. If you would like to listen to our previous sharing, you can find them under the video tab of Watson's Facebook page. So for today's segment, I will be sharing our hair loss and next scalp allergies. So before I dive in to the topic of hair loss, I just wanted to reassure you that the regular adult sheds around 100 strands of hair a day. So this usually does not lead to a noticeable thinning of hair on the scalp, since new hair is also growing out at the same time. However, in some individuals, this cycle of hair growth and shedding is disrupted, and in more severe cases, the hair follicle is destroyed and replaced with scar tissue. So when there's scar tissue, then the hair cannot grow properly lah. Yeah. So there are two broad categories of hair loss. There's the scarring alopecia, like the kind that scars, that is a result of scarring, and there's the kind that is a result of non-scarring. So the most common form of hair loss are male and female pattern baldness lah. So this belongs to the category of non-scarring hair loss, and it usually presents as thinning hair with no signs of scalp inflammation. So there is no like redness or there's no obvious scar on your head. And this is the only form of hair loss that can be self-treated in most instances. So some causes of female and male pattern hair loss are genetics, hormonal imbalance, particularly high levels of testosterone, and sometimes but also sometimes hair loss could result from existing medical conditions like low thyroid levels and use of certain medications like ibuprofen. But of course, just to note, not everybody who uses ibuprofen have hair loss. It's just that some people do. Okay, so there are some options you can consider if you're experiencing male or female pattern hair loss. So first, we have applied hair lotions containing minoxidil, which can help to increase blood circulation to the hair follicles on your scalp to stimulate the growth of hair. So hair lotions containing minoxidil can be obtained over the counter, and some possible side effects to note when you're trying out minoxidil for the first time include itchiness, dryness, and scaliness at the site of application. It's more of a topical reaction to the minoxidil lah. But most of the time, it is tolerable. Of course, if the symptoms persist or worsen, then please consult a doctor or a pharmacist. So usually you can approach a friendly pharmacist, and then they can help you. Then if like it's really very serious, then of course definitely seek a doctor's attention. So so to increase the blood circulation to the hair follicles, the minoxidil lotion should massage into the scalp when applied. So usually you have to continuously apply for 2 to 4 months before appreciable hair growth can be observed. So the effects of minoxidil will last as long as you are applying. So after you stop the use of minoxidil, within the next 3 to 4 months, it will start to shed and you'll go back to your baseline density. It won't like cause you to lose more hair, but so you definitely have to continue applying lah, so that there's a continuous circulation of the blood flow to your hair follicles. So second, also avoid using high heat from hair dryers and curling iron on your hair, because like if you already have hair thinning, and then you use like high heat on your hair, the existing hair will be more brittle and more likely to be damaged. So then if it breaks off, it will look even more obvious. Okay, so third, also avoid using oily hair products because they can cause inflammation of the hair follicles and result in increased hair shedding. So like in the case of conditioner, just wanted to like reinforce, if you apply conditioner, just apply it to the ends or like away from the scalp, because this part is the drier part, and if you apply it to the scalp, that's how you get build up of hair products on the scalp, and then cause the inflammation and also possibly hair shedding, like increased hair shedding than the regular 100 strands per day kind. So fourth, also don't tie your hair too tightly because it puts strain on the hair follicles, and yeah, when there's strain and there's inflammation, and then then you go back to the increased hair shedding. So now I'll be moving on to our next topic on dandruff and scalp eczema. So scalp eczema can be categorized into atopic dermatitis and contact dermatitis. And meanwhile, there's also another condition called seborrheic dermatitis, which is aka also known as dandruff, which is what we are more familiar with. So this mainly affects the scalp. All three of these conditions may coexist, and they may present with similar symptoms like itching, flakiness, redness, burning, and swelling. So other conditions like psoriasis or fungal infections may present with similar symptoms too. And okay, so you must be like wondering what's the difference, right? So atopic dermatitis commonly affects young children, and it also typically occurs on other parts of the body. So that's like the thing that we usually, when we say eczema, most of us are actually referring to atopic dermatitis. So it affects your body, and also it happens to affect your scalp because scalp is a form of like skin. Yeah. So these affected areas may ooze pus. So that's one of the key factors of like atopic dermatitis. Like they may ooze pus, but they may not, but sometimes they also ooze pus. So this is very different from seborrheic dermatitis, which is the dandruff. So this is not a type of scalp eczema. So seborrheic dermatitis tends to develop during puberty or even like throughout adulthood, and the affected areas do not ooze pus. So it may also appear as cradle cap in infants, and for the case of cradle cap, usually resolves on its own when the child turns 1 year old. So possible causes of seborrheic dermatitis points to genetics, hormonal changes affecting sebum production, and also possibly due to the overgrowth of yeast on the skin. So some factors that can increase your risk of getting seborrheic dermatitis include existing skin conditions like acne, rosacea, and also it could be due to other medical conditions like HIV, depression, or like if you are on immunosuppressants, then it could also cause seborrheic dermatitis, and also the use of certain medications like lithium and sorelin . So sometimes flare-ups can occur in the presence of triggers like stress, illness, hormonal changes, and harsh chemicals. So but on the other hand, comparing these causes of seborrheic dermatitis to atopic dermatitis, it's not clear what exactly causes atopic dermatitis, but most factors point to possibly a genetics or environmental factors such as erratic changes in the weather or hot weather that cause sweating. So these are possible triggers for atopic dermatitis . So contact dermatitis, on the other hand, if it occurs on the scalp, it usually occurs when like you use hair brushes, hair accessories, or certain ingredients in hair products, particularly nickel, cobalt, balsam of Peru, and fragrances. And when this comes into contact with the scalp, it kind of like irritates the scalp, and that's how you get contact dermatitis. So the main difference is that contact dermatitis usually more from like external irritants. So now you must be wondering like how to reduce the occurrence of these flare-ups. So first, it is important to determine your personal triggers for the flare-up. If possible, every time when a flare-up occurs, you write in your notebook or like write in your phone, what do you eat previously, what was the weather like, what hair products were used, when was the last time you styled your hair, and was it like a period of stress? Because sometimes for certain jobs, there is a period of like there's more stress during like a certain time of the year, and then it could cause a flare-up. So if you note if you note the person, like the triggers for your, if you note the triggers for the flare-up, at least you can do some, like, you can avoid those flare-ups if possible. But if you cannot avoid those flare-ups, you know to take extra care of your scalp and like pay more attention lor. So second, another way to also reduce the occurrence of these flare-ups is also to if, like, let's say your scalp condition is not the result of an avoidable irritant or environmental trigger, you can also consider like dandruff shampoos. So look for shampoos containing zinc pyrithione, salicylic acid, sulfur, coal tar, selenium sulfide, and ketoconazole. So these products can be a bit drying to the hair, so you try to use them alternate days. So to combat this, you can concentrate the dandruff shampoo to the scalp, because the scalp is where the irritants is where the it's where the condition is occurring. So you want to apply the dandruff shampoo to the scalp and avoid to the hair, because the hair is not where it's residing. So if your hair still needs washing, then you can follow up with regular shampoo. So keep in mind that when you use coal tar, it can darken lighter hair colors. And coal tar also can make your scalp more sensitive to the sun. So when you go out, wear a hat also. But in general, I guess if the weather is hot, we also recommend, if you can, you avoid it. But if you cannot, you also wear a hat to like minimize the effect of the direct sun on your scalp, especially since if you already have thinning hair, then your scalp is not protected by the hair. So yeah. Okay, so once the symptoms have resolved, you may cut back to using the dandruff shampoo just once a week, from alternate days, every alternate day, to become once or twice a week. So in terms of treatment, cause just now we're talking about shampoos, right? So now let's go on to like the actual like treatment method. You can also try corticosteroid lotions during flare-ups to help reduce inflammation and itchiness. But because you want to avoid the side effects, you want to avoid the full range of side effects, so you try to not use it for extended periods of time and only use it when necessary. So in addition, for seborrheic dermatitis, you can consider the addition of ketoconazole lotion to reduce the yeast overgrowth that may be contributing to worsening symptoms. So if the itchiness is unbearable, you can also consider taking antihistamine tablets to stop it, like cetirizine, Claritin, depending on like what is your regular antihistamine that you usually use. Then you stick to it, so it's more likely to work for you also. Okay, so if the scalp eczema is severe with pus, then you need to consult a doctor who is able to prescribe oral corticosteroids or even antibiotics if needed, because sometimes if there's pus and all that, it means that there is the scalp is quite damaged and there could be a risk of infection. So just try to consult a doctor if this happens. So some lifestyle changes that you can consider is using warm water when washing your hair. So you want to avoid the use of extreme temperatures of water, like extremely hot or extremely cold, because it will dry out your scalp. And also use gentle shampoos and hair styling products. So preferably fragrance-free, because fragrance is also an irritant, a possible irritant. So if you experience a flare-up, avoid scratching, as it can result in broken skin and potential skin infection. So also consider, at some of our pharmacies, we do keep like a scalp moisturizer containing menthol. It can help to soothe your scalp, and it's non-steroidal. So for some people, I understand that the use of steroids could be a concern. So then you can consider this scalp moisturizer. So it helps to it contains ceramide, it helps to repair the scalp, and also mitigate the risk of possible infection from scratching lah. So reach out to your doctor if your condition worsens or appears infected. So symptoms of infection include severe itchiness, new burning sensations, blistered skin, fluid drainage, white or yellow pus, and of course if there is fever, then you know, if there is, it's quite serious, so go and see a doctor. So okay, so although eczema and seborrheic dermatitis are chronic conditions, there are many options available to successfully manage your symptoms and get relief. So after your initial flare-up is under control, you may go weeks or months without experiencing any symptoms. So yeah, so that's all for like my sharing. So thank you for your taking time out of your busy schedule to tune into our Facebook Live. So for the next 5 minutes, I'll be taking questions. So okay, so Colleen asked, how do I know if there's excessive hair loss? Okay, so you can at home, right, or like maybe in a not so public area, you can perform a pull test on your hair. So you start with a small area of clean dry hair, and then you tug gently, like to see if it's like loose lah. Of course, for mine is tight, but like you don't tie your hair, then you just like pull here, and then you see if it comes out or not. That's like how well attached your hair is to the hair follicle. And let's say if around 2 or 3 hair drop, that's quite normal. But like if you have more than, if like let's say you tuck on like one bunch, like which is around 100, and then more than 10 hairs drop out, then maybe you should go and see a doctor to determine the cause. Okay, then also next question is that Julie asks, is dandruff contagious? Because my brother has it and worried that it is gonna affect me as well. So dandruff was like also known as the seborrheic dermatitis, which we were talking about earlier. So you can't spread or catch dandruff. So, and also like rest assured that the dandruff doesn't reflect poorly on your hygiene, because like even if you wash your hair every day, you're totally well groomed, there are definitely like factors that you might not be able to control, like maybe if you take certain medications and all that. Yeah, so there are certain factors that you will not be able to control, and you can still get dandruff. So they can still spot like flakes. Maybe it's not that serious, it's like mild. Yeah, so it's not really like, it might not really be a hygiene issue most of the time. And don't worry, you can't really like spread it. Yeah, so okay, so maybe for the next 2+ minutes I will still be taking questions. Okay, so Wong asked, what type of shampoo is suitable to prevent hair loss? Okay, so for the type of shampoo to prevent hair loss, we usually try to use gentle shampoos. Like let's say, because the weather is okay, so there are certain factors that could affect like hair loss. Also depends on how irritated your scalp is sometimes. So sometimes your scalp, if like you overwash it, maybe because the weather is hot, like or weather is erratic, sometimes it's hot, it's cold, then your hair gets oily, you wash more, then you kind of dry out the scalp over time, because our scalp, you're also washing away the natural oil. So the safest, like without any prior like any background information, I can just recommend that you try a gentle shampoo. Yeah, then then maybe if you do experience like male or female pattern hair loss, then you can consider the minoxidil option, which we talked about earlier lah. So just use a gentle shampoo, then maybe you add on the lotion. Yeah, just try not to overwash and like overstimulate the scalp to avoid like hair loss lor. So Tan asked, is there any shampoo to clear build up on scalp, so like your follicles are blocked? So this is okay. So there are some shampoo like those containing salicylic acid. So salicylic acid is like a mild chemical exfoliant. It helps to slowly break down the, of course it's not so strong, but like it slowly breaks down the thickened layers of the scalp like so normally our follicles are not blocked, so our oil can just come out, then when we wash it's clean and all that. But if like you have a lot of dead skin on your head, then it blocks the follicles, then you can consider using the things shampoo containing salicylic acid once, maybe like alternate days, not every day, like alternate days, to help to like initially remove the dead skin, and allow the pores to be open, so you don't block the surface and you don't like let it get clogged up. But don't use it too often because you also don't want to irritate the scalp. So Crystal asked, is our diet also a reason for hair loss? In a way, if this question is a bit more, it depends. So it depends on how well you are eating and how balanced your diet is. If your diet is balanced, then it's usually there, then maybe it might not be a cause. But also you need I would need to understand more about like what's your definition of balance, because my definition of balance might be different from yours. So but some things that you can do to increase the quality of your hair and the strength of your hair, so it's like it doesn't break off, like it doesn't get brittle and all that. You could take increase like amount of like protein, biotin, and yeah, there are certain supplements that you can take to improve like the quality of your hair so that it doesn't break off so easily, because breakage can also look like hair thinning from an angle, like when your hair, like maybe like I have some long and some short, then it looks like it's thinning, but maybe it could be hair breakage. So but if possible, you could try to increase your protein intake and take some biotin supplements also. Yeah. So for now, if you all have any other questions, you all can just like leave it in the comments and then I'll reply to it later. But so I'm glad like there's a lot of you all interested in this. Yeah. So thank you for taking time, and I'll catch you all again next time. Bye.